Greetings. My name is Mushtaq Memon, Professor Emeritus from Washington State University. I am delighted to have a conversation with Dr. Aisha Salam. She's a veterinarian and practices here in the Atlanta area. So I will let her introduce herself first. Welcome, and Dr. Salam, please go ahead and tell us something about yourself first.
Thank you very much. Like you mentioned, my name is Aisha Salam. I graduated from the University of Veterinary Animal and Veterinary Science in Lahore um, in 2009. And then I moved back to Dubai. That is where I was born and raised. I moved back to Dubai and I worked with equine for about 8 years. And that was mainly in Abu Dhabi where I worked. Later in 2021, I got married and moved to the US. I then started working on my US veterinary license to practice here in the US, which was quite an ordeal to get through and took a while and a lot of hard work, which we will talk about more as well. I got my US veterinary license in December 2022. And then I started practicing in 2023 January. That is last year is when I started practicing. So I actually switched from equine to small animals once I moved to the US, mainly because I didn't have many opportunities around to practice in equine again where I was living here in Georgia. So decided to try small animals instead, and I've been loving it since then, for sure, and will definitely continue with small animals. I currently work at Crestview Animal Hospital, which is in Cumming, Georgia, as an associate veterinarian. And I have actually completed a year in that hospital just last week. Um, and the plan is to just keep going on from there.
Wonderful. Uh, those of you who are not aware, I know that we have quite a few viewers from other countries. So, Dr. Salam mentioned that she's graduated from Lahore, and Lahore is a city in Pakistan. And then she was born and raised in Dubai. And those of you who are not aware, Dubai is one of the Emirates in the United Arab Emirates in the Middle East. So, this is some kind of background. So, Dr. Salam, this is a lot of steps that you have mentioned. Could you walk us through to see how you have reached to this stage where you are now practicing as veterinarian and associate veterinarian in the private practice? What steps you had to go through to get here?
Absolutely. In order to practice in the US, you need to have an American veterinary license here. And for any veterinarian, be it a foreign veterinarian or a veterinarian who has completed DVM from an US accredited university, also has to give the boards, which is the NAVLE, which stands for the North American Veterinary License Exam. For foreign veterinarians who wish to come to the US and practice here as veterinarians, they need to go through a few more steps before giving the NAVLE. And there are two routes that I believe that are available. One is through the ECFVG, which comes under the American Veterinary Medical Association. If you go to avma.org, you will get more information on that, on the ECFVG. And the steps in ECFVG are you have to clear the IELTS or the TOEFL, that is an English proficiency exam, which can be done online. After that, you have to complete and pass your BCSE, which is the Basic Clinical and Science exam, which is also an online computer generated exam that you can do. And then after that, the last step to complete the CFPG is the CPE, which is a clinical proficiency exam, for which you have to travel and you have to be present on site, which can either be in Las Vegas, in the US or in Mississippi in the US. These are the two sites that conduct this exam. Um, the availability of this exam, I believe, for the CPE in Vegas is twice a year. I think the window is April and then December. I'm not sure about Mississippi. That is something you will have to look online. Once you have completed these three, you also need to complete the NAVLE. And the NAVLE comes under the umbrella of IVMA, which is the International Veterinary Medical Assessment, I believe, if I'm not mistaken. So these are a few exams that you have to complete in order to get your license. Um, while you are still in your home country, be it India, Pakistan, anywhere in the world, you can go ahead and start this procedure of at least doing the online exams like the English proficiency exam, the BCSE online exam, and also the NAVLE exam, and then start preparing to travel for the CPE, which you need to do here in the US. I would advise all the DVM students to, if they wish to travel and work in the US, in North America or Canada, to be more focused about these exams from year 2 or year 3 in their DVM program, and start preparing for this exam from then on, because you have all the materials and the concepts fresh in your mind. It's much easier to study and keep that momentum going even after you've graduated and you are a DV and you hold a DVM certification, and the momentum keeps going on, and it's easier to retain these informations and then to do these exams. So my advice would be to, if this is what you want to do, come to the US and obtain the license, is to start preparing for it, during your DVM program.
Wonderful. So, Dr. Salam, what is your assessment or observation? Are there some opportunities in the United States, or how long they are going to be there? Is it particularly just small animal, or many of our veterinarians are really more into large animals, dairy practice, equine practice? Any observations on that issue?
Yeah. So currently, because I've only been here 3 years, and from my observation in those 3 years is there is a great shortage of veterinarians here in the US. Every clinic that I have been to, every CE or wet labs or courses that I have been to, have talked about and shared their issues of not having enough veterinarians around. In fact, even during my exam in the CPE, there were a few doctors who were like, if you need some jobs, you have opportunities here. So it just starts from, the time you enter here. People are looking for veterinarians everywhere. My own hospital, we're looking for doctors. So it's every clinic where they need veterinarians. So, and it's not just small animals. It is also for large animals, for equine, including farm animals as well. Exotics. Exotics is also very huge in the US. It's a very big skill to have if you are familiar with exotics treatments, diagnostics. That would be a great skill to have to come here and use those skills, because every clinic is looking for you. A doctor who has some experience in exotics. Our clinic itself, we have 2 doctors who do look at some exotics as well.
Wonderful. I have just one or two other comments and see if you want to respond to that. Number one is, I assume that with all these registration and taking these exams, especially come to the United States, it requires some kind of funds, some fees to pay. So those folks who are really want to complete all that, they should have maybe some amount of money. That's number one.
Absolutely.
Other thing I was thinking that I have observed quite a bit gender shift in our profession, at least in the United States. I think 70 to 80% veterinary students are female nowadays, and even developing countries I go to, you see more and more females are coming in. So on those two things, do you have any comments on it? I mean, you being a female, I'm sure.
Yeah.
Have you faced any barriers, any problems that our young ladies may be aware of?
Sure. So, your first question about funds, yes, you need to go online. You need to see what each exam costs. You need to see how much taking just registration itself is different. Giving those exams, there's a separate fee for that as well. Then you have to consider your traveling expenses as well. Preparation expenses are different if you want to get any online preparation courses or if you want to go and do any on site preparations as well. So you need to take all that into account, put that all together, and see if it's possible or not. Apart from that, a huge commitment is time and hard work. There is no shortcut to passing these exams. Time is very important here because while you are studying and trying to complete your DVM program, you need to also start preparing for the NAVLE and the ECFVG. So you need to try and organize yourself and start doing that, make time for it. So that's very important. For females, it is not any different at all. Several opportunities, equal opportunities for male and females here. I myself did not face any issues. Nobody was biased. No discrimination at all. So everyone, male or female, have equal opportunities here.
I think there's a lot of information. I hope our viewers are taking benefit of that. And I thank you very much, Dr. Salam, for sharing
My
with
pleasure.
all this information with us. Anything else you'd like to tell our viewers?
If you have any questions or anything, you can definitely comment and ask, and I'd be happy to answer those questions.
I think once you view this our conversation, there is a place that you could ask questions or comments, and if you put it there, then I will pass on to Dr. Salam to see if we could also post your answers there.
Yeah, absolutely.
So wish you well.
Thank you very much.
You're very welcome.
Thank
Thank
you.
you. Bye-bye.